President Trump officially declares the opioid crisis a national emergency and has instructed his administration to respond to the crisis. Trump made the announcement in front of reporters while on his working vacation in Bedminster, New Jersey yesterday. He told reporters, quote, "We're going to spend a lot of time and a lot of effort and a lot of money on the opioid crisis." To explain how the government is trying to tackle the opioid crisis, we're joined by Kimberly Leonard, senior healthcare writer for the Washington Examiner. So, Kimberly, what does a national emergency entail? What does it mean? And what's the significance of the president declaring one?
So he just declared it yesterday, and what it means is that there are going to be additional federal resources that are given to the effort. It removes a lot of the red tape that we see around where Medicaid funds can go, for example. It allows for more treatment, and it means that federally, they're saying this is a priority for us and we're going to work on it aggressively.
So then what is the next step? Where do we go from here?
The next step is that we'll really start seeing details about what they're going to do on this epidemic. We are expecting to see access to naloxone, which is a overdose reversal drug. And we're expecting to see more access to other treatment options that really help people with some of these addiction problems.
You were touching on this before, but maybe you can expand a little bit more on this in terms of what the resources the administration can and will likely be using.
Right. Well, there are resources that are set apart for federal emergencies, and usually they're set apart for things like hurricanes or other natural disasters. But the opioid epidemic has gotten so bad. That's why the Federal Commission recommended that President Trump declare a national emergency. So those funds that would typically go to some of these other disasters are going toward the crisis, and they're going toward treatment and toward recovery and toward a lot of these expensive programs that are required in order to really stave off some of the issues that are occurring because of the epidemic.
Okay, very good. So we're going to continue to watch the opioid crisis. I want to shift gears to the health care bill now. What are you hearing from your sources about what could potentially happen with a health care overhaul? Could it happen as soon as this fall? What are you thinking?
Well, there are several different things that are happening right now. First of all, the House Freedom Caucus has filed a petition today saying that they would like for the repeal and delay bill, which would delay the implementation of Obamacare repeal for 2 years. They want to see the House vote on it. It's difficult to say whether that'll go anywhere. Basically, they have to have enough signatures on this petition to even bring a vote to the floor. Now, this is the same bill that didn't pass in the Senate, so it's hard to see it go anywhere. It does put House members on the record for how they would vote. And the other thing that we're hearing really is that senators are saying we're ready to move on, we're ready to work in a bipartisan way. We want to come up with solutions that will stabilize the health insurance exchanges.
And what's going to be interesting is to see how all of this plays out with midterm elections right around the corner. Kimberly Leonard, senior healthcare writer for the Washington Examiner. Thanks so much for talking with us.
Thank you.